My name is Tom Willman, physical therapist from Apex Orthopedic Rehabilitation. We're right in Wyckoff, New Jersey. Today we're going to talk about what's a lateral shift or a crooked back. There's a lot of different terms we'll talk about, but we're going to talk at the very end a bunch of ways that you can try and fix this for yourself. So stay to the end. But first we're going to talk a little bit about it. So a lateral shift, we'll commonly refer to it, or an acute scoliosis, are kind of some of the terms that are used. They call it a windswept spine. Never heard that myself. I just read it actually recently. A trunkless, and some people refer to it as a crooked back. All right, so you essentially, what it looks like is your back is shifted to one side. Okay, oftentimes when you have your back shifted to either left or the right, there's no side that we notice with people. Typically what we'll see is that the shift is this side. This is considered, if I'm looking from behind, this is a left lateral shift. So the direction that's moving away from the spine is a left lateral shift. And I'll be like this. Typically you'll see pain on the opposite, called a contralateral shift. So pain is here, shift is here. If you have pain on this side and your shift is on that side, same side, pain this side, it's called the ipsilateral shift, and that's not nearly as common. So these shifts are not shifts that you've developed over time. Gradually over the years you've shifted over to one side. That's different. This is something that's happened kind of immediately. You kind of woke up with it, where you did a particular movement and then you got what they call this acute shift, like this. Sometimes they're subtle, just like you just feel like you're a little bit off to one side. Other ones are like really big. I remember my stepfather had it at my wedding. I was walking on the golf course and you could see he was probably 2 or 3 inches off to the side there, really shifted. But it can be more subtle. And what you'll notice is that when someone has a shift, when they're standing, let's say I'm shifting here, I can't cross midline, like I can't quite shift to the other side. I'm blocked a little bit. I still can go a little bit like this when I do this. You'll see, but I can't quite cross midline right here easily. All right. If anything, I kind of tend to shift right back into place. So normally we'll see this. We'll have some lower back pain with the shifts. So only about 10% of the population that has lower back pain will have this lateral shift or acute scoliosis. Some people believe it's related to a herniation or disc bulge or even inflammation in the lower back, but we honestly don't know the exact reason why we have these shifts. But we do, it's very, very clear, they're very recognizable. An interesting thing too about these is that they're very hard to treat. You'll find that even when we show you these exercises, they're very frustrating. They typically revert back to the original shift very quickly, okay? So it takes a little while sometimes to correct these and have them really stick and get back to what you want to do. Not that you can't handle them, but they are definitely kind of finicky. So in certain times, we don't want to really engage and try and fix this, okay? And that's if you have any kind of red flag. So if you're having any kind of progressive weakness down the legs, where you feel like you're weak on one side, I wouldn't do that, especially if you notice the weakness is getting worse, okay? So that's one thing you want to be concerned about. Another thing is, do you have any bowel and bladder changes associated with this? So while I have this shift, or scoliosis, whatever you want to call it, now I'm developing bowel and bladder problems, and that's something that you want to then not do it and seek a medical examination by a physician, actually. Another thing is if you've had a history of an infection, fever, cancer, there may be some reason why you have this. You want to basically wait till you talk to someone. The other situation, a history of osteoporosis, where you're more fragile, you may not be able to do certain stretches that I'm recommending. In addition to that is if you had a trauma, you fell down the stairs, you had some kind of clear trauma, you had a car accident or something like that. When you have this shift, you want to make sure you get some imaging and get an x-ray or an MRI, whatever is appropriate, but basically get an evaluation by a physician to make sure you're appropriate for that. So just keep that in mind if you notice any of those factors, if you don't have the red flags. And check in my description, you'll see a little thing on red flags for lower back pain, and it'll go into a little bit more detail of what we're discussing. Okay, so we're going to show you the first progression as far as taking care of a lateral shift yourself, okay? And one thing we want to clarify that we're going to talk about one phenomenon called peripheralization and centralization, okay? So let's say that you have pain in this area right here and you're shifted, the pain's over here into this region here. It's down to, let's say, the mid-thigh, okay? When you're doing this exercise, if you're doing the motion, when you start, if that pain starts moving up and now it's no longer in your thigh and it's more kind of in the buttock, and you do it more and it starts moving up to the central lower back, that's a good sign. That's called centralization. And typically centralization is a positive direction, okay? If you have pain in your buttock and there's no pain below the buttock and you're shifted over, okay, so I'm shifted over here, I have pain just in my buttock right here, okay? And this is commonly what you'll see is the shift is here, but the pain's on the opposite side. If now I'm doing this correction, I'm going to show you this exercise, and now I'm starting to get more thigh pain and let's say some knee pain, that direction is called peripheralization, and commonly it's not a good direction to go in. We don't want to reproduce pain that starts moving away from the area where we think this is coming from, and it's the lower back. So consider that. Peripheralization, just remember, if it starts moving up to here, that's a good sign. If it starts moving away and further down away from the area as we're doing the exercise, then we want to stop, okay? And that's one of the safety measures or tips to prevent you from doing something that'll make it feel worse, okay? So let's take a look. So this is considered a right lateral shift. And what we're going to do first is we're going to try and just shift our hips over and try and get past, so this part of our body goes over midline. So if we're here, we're shifted this way, we want our shoulders or our midline to go across. So what we're going to do first, and we can do this without anything else, is just try and shift over and back. And all you're trying to do is just move your hips underneath and your trunk over. So hips go this way, trunk goes this way, all right? I'll typically tell people to do 10 to 20 times, about 5 sessions a day. If we're unable to get past the midline, then we stop there. We keep on working on this direction. Now, if just putting pressure and trying to shift like this does not work, then the next progression is to actually put your hand on the hips here, shoulders this way, and we're trying to shift our body across. So we're pushing this way and trying to tip our body. We want to get to the point where the upper body crosses over. So shift over, pressure on, and you can bend your knees a little bit like this, pressure on, pressure off. So pressure on, and then pressure off. So you can do this repeatedly. And you'll notice, like some people, it'll take a while. They cannot make that alteration. And they need a lot of pressure, and more pressure. But you gotta monitor, like we talked about, where the pain is and how it moves and how it acts, okay? Once you get past the point, if you get to the point where, wow, now I'm shifted over to the other side, the second point of this exercise is then, most people, is you want to go into lumbar extension. You want to then extend, okay? And then do 10 times of lumbar extension. If you can do it with just body weight, you can correct the body weight, but you always end with trying to get a little extension, because most times you have a lot of people have a block in extension. You'll see they're here. Once we can correct the shift, we can then work on lumbar extension. So 10 this way, and then 10 arching, okay? None of these things should make your condition feel worse. So sometimes when we do the correction, if you look from a side view, we want to be totally in line. So our direction, when we push, is straight in this plane right here, okay? So we're going to be in this plane like this. We're going to shift over. Sometimes this is a hard position for you to be in. So I'll tell certain people to lean forward a little bit and try and do the correction with a slight degree of flexion meaning forward of our back, as we do the shift, like that, okay? Or even a little bit more flexion like this. We'll shift and come across, okay? I would start with being upright and try and make the correction over like this. And then after, a day of doing these, you could probably try a little bit of flexion and see if it feels a little more comfortable. You'd be surprised. Eventually, still, once we cross, and even when we start with a little bit of flexion, we do a little cross, remember, we're still going to go into a little bit of extension, okay? So everyone understand that? So we're first doing the side glide to correct the shift. So this is right lateral shift, and we're doing a left side glide, okay? And then we follow with lumbar extension. Okay, that's the most typical progression you'll use. So Noah's going to show us, he's going to demonstrate a shift over like so. We're going to put his arm up like this. And this is if you need a therapist to help you out with this. We're going to stand like so. We're going to grasp, and we're going to shift over. And we're going to do it repeatedly for a few times. Sometimes we were not successful initially. He's going to shift, we're going to block it, and then eventually boom, boom. Now we're overcorrected. And then we're going to go into a little arch and extend, okay? So shift it over, okay? I'm going to come across, shift, cross midline, and then extend back, Okay, and have the patient extend. We're not going to have pushing it back. He's then going to actively move back so he can control the amount of pressure. I'm not suggesting you do this with a friend, but what I'm suggesting is this is something, if you can't correct yourself, maybe seeking a little bit of help will give you you need a little extra pressure that you can generate. All right, so sometimes using the wall, so you can put your body against the wall, allows a little counter pressure. It's a little easier to get the glide correctly, okay? So you can do it a couple different ways. One, you can put your hand out. So if I'm shifted this way, my hips are that way, my symptoms, I should be typically the painful side away. Hands out like so, pressure on, pressure off like this. Pressure on, pressure off. You can also do it if it bothers your shoulder a little bit. You can take your arm like this at your side and just be a little offset. This is straight up, just a little bit out. Hands like this. And make sure it's a little high, so it's pressure on, pressure off, okay? And like I said, you can bend forward a little bit if that's more comfortable. Eventually, if we correct it, and this like I'm corrected right now, we want to kind of step, keep that correction, and then lean backwards. But these are hard, these are finicky. I said this earlier. It may take a few times for you to correct it, and sometimes you can't go into extension, it's just too tight. All right, so consider that as another option for correcting the shift. So there's a couple ways you can correct this lateral shift. It's really something that's done much better, in my experience. Most of the corrections are most successful in standing. They're less successful if you try and do it lying down. And I'm going to show you two ways of trying this that may help you create the correction. The hardest thing is once you go from lying down and you make the correction, it's hard to do the extension afterwards and to get off the table. As soon as you get off the table, typically you lose the correction that you're trying to make and you're shifted right back to where you started. So one way you can do this, you can take a couple pillows, even more. Let's say if I'm shifted this way, okay, I'm going to lie on the table and I'm going to put the pillows in this side, okay, where the shift is. And then I'm going to show you the next part. You typically have to have a partner do this with you because it's typically very painful as you get into this position. So you're going to shift over and overcorrect into this side position, all right? And just kind of settle there, and then we'll have, if you have a spouse or someone that can help you out, you'll slowly take a pillow away as you get more comfortable. And you're basically letting the body weight reduce the shift, okay? Problem is you can't typically overcorrect for this, okay? If it's settling, you can try 30 seconds to a minute, and then slowly take pillow away. Take the next pillow away. And then once you're here, you can just try and prop up into that side bend position. So we're overcorrecting that shift, okay? It's all based upon how it feels. If it's bothering you, then, or it's making the pain worse or peripheralizing the pain like we talked about earlier, then you don't want to do it. Eventually, if you feel reasonably comfortable in this position, you've overcorrected the shift. You're going to lie on your stomach and then do a press up, okay? And then back down. So you can do 10 of the lumbar extension, but instead in standing, you're going to do it lying down. I just had someone recently that basically got on their mechanical bed, had the shift, they left their pillows, and they essentially turned on the motor and lifted the bed up. That created a side shift. And they said it actually helped them correct and made that transition from from lying down to sitting up a little bit better. And they actually done it a couple times. Literally just first time I've heard of this, but they actually had some success with it. It really helped them out. So they basically started here, and with one of the beds where you can kind of pull up the head of the bed, you slowly, I don't have it here, but they basically lifted it up, and they did that same overcorrection. Okay, so it's just an option. Remember, go about it gradually. Take small mini steps. Don't take big leaps with these things in general. Okay, hope that helps you out. Okay, so we've shown you a few different ways to correct a lateral shift. You can do it to either side. Same things apply, left or right. A few different ways of correcting this. If you don't have success, after 2 or 3 days, you may really need to get an evaluation from a physical therapist to really give you the best, because this may not be the appropriate exercise for your type of back problem, okay? And remember, none of these movements should make you feel worse. If they do, please stop and seek help. If you really enjoy this, please hit the like button, share it with a friend or so, and turn off your notifications so you can catch future videos from us, and definitely put a comment in if you have something that you have a question about or really liked it. Okay? Have a great day.